listened to what Brian said about Dr. Templin and the PowerPoints, and I ate my PowerPoint while the others were talking because he scared me. I'm just going to talk to you about Medical Care for Children Partnership Foundation, MCCP Foundation for short. I'm going to tell you what we do, I'm going to tell you how we do it, and I'm going to tell you some stories that demonstrate our successes, because it's really an exciting program. What do you know about Fairfax County?
Diverse.
Sorry?
Diverse.
Diverse, yes. What else? Is it a
Congested.
poor county?
Congested.
One of the wealthiest in the country. I forget what the ranking is. Anybody know? Second in the country? Something like that. But very diverse. So this is interesting because a lot of people don't know that. They just think of Fairfax as wealthy, McMansion after McMansion, and everybody is happy, and we all go out to dinner 7 times a day. So, but that's not the case. So I want to tell you what the case is for a lot of people living in Fairfax County. Think back to your own children or a child that you might know, a niece, a nephew, or a friend's child. Suppose that child had a stomachache and was crying and unhappy. What would you do? You would probably, sit them down and think about what they had eaten and maybe give them a hot water bottle for their tummy and just kind of watch it. If they continue to be upset, you might think, gee, maybe I should call my pediatrician. And you might call the pediatrician and talk to a nurse and explain what's going on, and the nurse would probably say, well, watch for a little while. If it seems to be getting worse, bring them in. We'll fit them in. Is that true? That's probably what you and I would do. But for the population that we serve in Fairfax County, this is not an option. The children have no health insurance. They have no access to their own doctors and dentists until they come in contact with us. And they are low-income working people. So mom is thinking, oh my gosh, this stomachache, maybe it's just something they ate and it'll pass in an hour. But maybe it's food poisoning. Or as the child gets more and more in pain, they think, well, what if it's appendicitis? What am I going to do? Because I don't have a doctor for the child. I could go to the emergency room if it's bad, but that's so expensive. I have to pay my rent, I have to pay my utilities, I have my food bill. What do I balance? How do I do this? And so what usually happens is they wait much longer than you and I would wait with our children. They don't have the peace of mind of calling up and at least talking to the nurse in the office. And so they're panicked. And after a while, if the child is really sick, they will go to the emergency room, and it costs you and I a lot of money in taxpayer dollars. So this is the problem that we want to solve, or at least tackle. We find that in Fairfax County, there's probably almost 9,000 children who could qualify for our program. That's a lot of children in a rich, rich county, because it is so diverse, as you said. There are lots of pockets of poverty in the county. Our children are in families with family incomes up to 250% of poverty level, which for a family of 4 is about $55,000 a year. Now in Fairfax County, it's very hard to live on $55,000 a year for a family of 4. Our families are all working. Mom and dad might have more than one job, but the jobs are usually part-time with no benefits, no health insurance. Dad could be in construction, mom could be a waitress, maybe they're working at McDonald's a couple hours a day to bring in extra money. So it's a lot of piecemeal work that doesn't have health insurance. So these are the working poor that we deal with. So we are the last safety net for these children. They're either slightly higher income to qualify for other government programs like state children's health insurance program, which is called FAMOUS in Virginia, you might know that. They're a little bit, that's cut off at 200%, now I'm getting wonky. We take them up to 250, they could be on a waiting list or they could be undocumented. But we're the last resort. And we're a great resort. So what I want to tell you is that's what we do. How do we do it? We are an exciting public-private partnership, really exciting. We have 3 sets of partners. One, we partner with Fairfax County Government Department of Family Services, and they provide the social work and the casework for us. Second group of partners are the medical and dental community. And these are over 300 doctors and dentists, just people out in the community who have good hearts, who contract with us to take care of our children at reduced rates. And so a doctor or a pediatrician's office, maybe they have 10 pediatricians in there, they might take anywhere from 2 to 30 of our kids, depending on what their capacity is. Dental care is a tremendous need for us. Last year we spent over $400,000 in dental care because these kids could be 10, 12 years old. We take kids from birth to age 18. They could be 10 or 12 years old and had never been to a dentist. So we had to pay for root canals. We had to pay for all kinds of reconstructive work in their mouths. So, you and I know and have the capacity and the wherewithal to take our children to the dentist when they're preschoolers and from then on. But these people have no way to do that before the MCCP program. So, we do a lot of dental care. And as you also, I'm sure you know, dental care is not just a cosmetic thing or to relieve pain. It has to do with the entire health of the body. Because, if you have a problem in your mouth, and it can spread throughout the body and cause major issues. There was, in fact, a tragic story you may remember in Prince George's County in Maryland, where a young man died from a dental abscess, and it just spread throughout his body.
It was like 9.
Yes, it was 9. Yeah. So we don't want anything like that to happen again. So we also are another medical partner we have is Kaiser Permanente. They take 1,400 of our children a year for free, which is a fabulous contribution to the community. So Kaiser and our 300 other doctors and dentists are our second group of partners. Our third group of partners are our financial and time contributors, people who volunteer with us, people, when you run a nonprofit, and MCCP Foundation is a nonprofit 501c3, one of the first questions I get from funders is, are you lean and lean? They want to make sure we don't have luxurious offices and I'm not driving around them to show. So I say to them, no, we are not lean and mean. We are skinny